It's a small gland that plays a big role in your body. We're talking thyroid and the endocrine system as a whole with an expert in the Marshall Health Source podcast, starting right now.
You are listening to the Health Source podcast, presented by the Marshall Health Network. Now here's your host, Rick Lord.
Welcome inside the Marshall Health Source podcast studios here on the campus of Marshall University. This is another episode of the Marshall Health Source podcast presented by the Marshall Health Network. I'm your host, Rick Lord, and today we are pleased to be joined by Dr. Pruthvi Goparaju, an endocrinologist as part of the Marshall Health Network. First of all, doctor, thank you so much for your time today. Before we dive into it, because I know there's a lot to cover, I mean, when you talk about the endocrine system, it is a very wide-ranging system that controls and regulates a lot of the body. So just talk about your background, how you got into this field, and what brought you to West Virginia.
All right. So firstly, thank you for having me. I'm Dr. Goparaju. I've been here with Marshall Health for a little over a year, and so far it's been very enjoyable. Since medical school, I was interested in endocrinology, just as a specialty initially, but then over time, I've started to realize the value and the amount of time I spend with patients, like having a longitudinal relationships with the patient and the community. And, this combination is what drew me to the specialty, where it's mostly preventive medicine, especially with conditions like diabetes and thyroid. And, like even small differences today, it can make big impacts in the long-term health. And, like I said, I was interested in community health after graduation. So that brought me to West Virginia.
So when we talk about the endocrine system as a whole, it really regulates a lot of the body, and people might not understand how deep diving that is. For lack of a better way to put it, kind of just dealing with hormonal imbalances, really, in the body. If you could put on your professor hat right now, and pretend we're sitting in Endocrinology 101, and give us just an overview, a Cliff's Notes version of what the endocrine system is and what it does in the body.
Yeah, so like you said, there's a lot of glands, which are endocrine glands, which make a lot of hormones. And, the most common, obviously, is the thyroid. But apart from that, we have a endocrine gland in the brain called the pituitary gland. We have a couple of endocrine glands sitting on top of the kidneys called adrenals. The testicles in men and the ovaries in women also are kind of endocrine organs. So from top to bottom, there are multiple endocrine organs playing multiple different functions. Most of them, they help in regulate our metabolism. They help in regulate our blood pressure, energy levels. And so any kind of hormonal imbalances can affect the quality of life, can lead to new chronic conditions or worsening of existing chronic conditions like diabetes and hypertension as well.
Why are hormones so powerful? I mean, I know it seems like a simple question, but I mean, a lot of people are probably wondering, what makes these glands so overpowering in the system, and how they regulate things.
Yeah, that's an interesting question. Just because of the action mainly. For example, if you take thyroid, right, so nearly every tissue in the body, like the heart, the muscles, the digestive system, the brain, every tissue relies on the thyroid hormone to be able to regulate energy properly. So the thyroid hormones help decides like how fast or slow an organ works and how efficiently energy is being used. So things might be normal from another standpoint, but if there is some hormonal imbalance, it's mainly the energy efficiency is what gets affected, and that is what leads to big clinical impacts, even if the hormonal imbalance is small.
Yeah, and now when you're dealing with some ailments, it's pretty obvious what's wrong, right? With something like a thyroid, because it is so wide-reaching, and it does affect like sleep, weight, energy level, mood. What are some of the early symptoms that you might want to let people know about, that maybe it is something more than just, I'm having a bad day, maybe their thyroid is off a little bit?
Yeah, like I was telling you earlier, like thyroid hormone is a very important hormone for metabolism. Almost every tissue in the body relies on it. And the way sometimes I explain to my patients as well, it's almost like gas, for a car. So for example, if you have an underactive thyroid, if you have very little of thyroid, everything slows down. We start feeling tired, the digestive system slows down, so you might have constipation, you might feel too cold because, you're not able to manage temperature anymore. Your heart slows down, you might have brain fog, hair fall. And similarly, if you have too much thyroid for any reason, everything is fast. In fact, if it's slightly more, some people might actually feel better, but eventually you'll wear out and you will feel tired anyway. But then your heart beats too fast. You might have diarrhea, where your digestive system is too fast. You start losing bone density. So they're quite the opposite. But the symptoms I would watch out mainly, is the fatigue and weight. So if you're gaining weight, if you're tired, you should get, there's a chance you have an underactive thyroid. And if you're tired but losing weight, there's a chance your thyroid is hyperactive.
And in some ways, some of the symptoms for when it comes to your mood can mimic like anxiety and depression. Is that right?
Correct. Especially with thyroid, like we know for a very long time that if you have an underactive thyroid, it can mimic symptoms of brain fog, difficulty concentrating, and excessive thyroid can present like anxiety. Patients have palpitations, and sometimes it gets confusing with anxiety. And there are other hormonal conditions as well, which sometimes they're diagnosed late just because how easily they can mimic common mental health conditions.
So you talked about hyperthyroidism and hypothyroidism, too much, too little.
Correct.
And those can be done through a simple blood test, right? You're looking at THS level or TSH levels and like T3, T4.
Correct. So both hypothyroidism and hyperthyroidism, at least for the initial diagnosis, the simple blood tests. Sometimes we might end up requiring additional imaging. But you're right, most of the time we diagnose them through blood tests.
And full disclosure, I actually have a thyroid condition, Hashimoto's, which is an autoimmune disease. So maybe talk a little bit about the difference and what makes things like Graves and Hashimoto's unique or maybe unusual compared to just a normal thyroid condition.
Yeah, so firstly, once you have an autoimmune condition like Hashimoto's, where, to explain in simple terms, the antibodies attack the thyroid, and the thyroid is not able to make enough thyroid hormone. Graves is unique, though, where the antibodies actually stimulate the thyroid. So the thyroid makes too much thyroid hormone. So if you have one autoimmune condition, you're at risk for developing other autoimmune conditions. Many times they're closely associated with each other. So when you have Hashimoto's, it usually causes underactive thyroid, where you're not able to make enough thyroid hormone, and you go through the symptoms we have discussed earlier. And it's the good thing is it is easily treatable with a daily pill, which literally replaces the hormone.
Levothyroxine.
Correct.
Synthroid by the brand name.
Yep. Whereas if it's hyperthyroidism, we have a wide range of options for treatment. There's a medication, there's radioactive iodine therapy, and there is surgery, and you get the thyroid out. And
as with anything else, it's important to stay on top of this because especially with thyroid conditions, there is a lot of trial and error to make sure that you're getting the levels right. I've been put on 175 micrograms down to 110. Every time you go in, every few months you get your blood, and they're trying to find those levels, and there will be some hit and miss. So be patient and listen to your doctor.
Absolutely, and the other issue with levothyroxine or Synthroid is, I call it a high maintenance medication. So you need to take care of it. You need to take it alone on an empty stomach, and because it's long acting, even if you miss a dose or two, it can affect the labs, like you just said. Until we get to that exact dose for a person, yes, we usually require multiple labs. But once it's settled down, usually, you need to do labs maybe once every 6 months or a year.
So are there any lifestyle choices that can affect your hormone levels as a whole?
It's difficult to answer it as one generalized lifestyle modifications. Each hormone has its own caveats, to be honest. But many hormones, especially hormones like cortisol, they are known to increase with stress. So stress is a very common trigger, which can affect multiple hormones. And similarly, there are many hormones which can get low or imbalanced with weight gain. So obesity is also associated with a lot of hormonal dysregulations. So I would say those two are the main big things.
Are there any subtle signs that might not necessarily show up in blood work but would still be considered clinically important to look out for?
You mean in terms of thyroid, or?
Yeah, just in terms of they would still matter clinically. You might not catch something on a TSH test. The blood work might not be necessarily off, but they still might have something there.
Yeah, usually it is not such a problem these days because the TSH assays are pretty sensitive now. So we are able to catch them early. But, and then probably that's the reason why we don't have strong recommendations to screen everybody for thyroid conditions routinely.
Right.
But the main thing is, I would watch out for the symptoms we discussed, especially anything related to weight and tiredness. And then you should strongly consider getting screened for thyroid conditions, even if you don't have symptoms, but you have a strong family history of thyroid disease. You have another autoimmune condition, which automatically puts you at risk for thyroid. And similarly, women who are pregnant or planning to become pregnant, thyroid function is very important around that time.
And it does seem that thyroid conditions affect women more than men. Is that accurate?
Correct. Both underactive thyroid and hyperactive thyroid graves have a female predominance. In fact, even thyroid nodules. So for some reason or the other, females tend to be more affected with thyroid conditions than men.
Yeah. And the thyroid can be very nodular. It's for those who don't know, it's a little butterfly-shaped gland in the neck. And it is important to get those images done because something, especially if you have a thyroid condition, you want to keep track of to make sure that those nodules don't turn into something more dangerous.
Absolutely. Most of the times we either catch them on physical exam, or sometimes you end up doing a scan for another reason and you incidentally find these nodules. The reassuring fact is 95% of them are benign. But the remaining 5%, they require close follow-ups with serial ultrasounds. And if they start to, get suspicious, we need to do a biopsy to make sure they're not cancerous.
Now, endocrinology also covers diabetes, which is a huge problem here in West Virginia. What are some of the things that or some advice that you might have for people that might be pre-diabetic or that or maybe it runs in their family and they're looking at, making sure that they can stay healthy? I mean, in a population like this, it's important to stay on top of that.
Yeah, absolutely. So once somebody has pre-diabetes, the biggest goal is to avoid diabetes, right? And we have studies showing that the best way to do it, in fact, is through lifestyle and exercise. So various studies have showed that if you're able to eat healthy, if you're able to put in that exercise every week, that's the biggest chance you have to decrease the chance of progression to type 2 diabetes. Of course, there are in some situations it's not always possible. We have medications like metformin, which can decrease the risk of developing type 2 diabetes in patients who have pre-diabetes.
Is there anything that's happened over the course of the last generation or so that has really helped advance the diagnosis and the treatment for endocrine problems?
Oh, absolutely. When it comes to hormones itself, I would say we have much better assays these days because the issue with many hormonal testing, it's not straightforward. I can't just order it like a routine blood test and interpret it. There are so many caveats surrounding each hormone. Like for some hormones, literally the time of the day, the position the patient is in, everything matters. So, and the context matters hugely. So that's why the biggest development has been we have very sensitive assays now. So our testing accuracy is better. Mm-hmm. Similarly, the endocrine glands, most of them are pretty small. So we have very sensitive imaging these days to, look at them closely and characterize them properly. So I would say those two are the biggest advances we have in helping us diagnose.
And certainly important once you are diagnosed with diabetes to stay on top of it because it's maintenance and it's lifelong maintenance.
Correct. It's a silent killer. Even if somebody's blood sugars are high today, they might feel fine, but it's just a matter of time. They land in some complication we don't want them to, right? So that's the issue. So it's a chronic lifestyle disease. So sometimes it's tough to stay motivated. So the best way to look at it is, just treat them like habits, so that even when you have a busy day, even when you have a bad day, if they're habits, you still do them, and that's the best way to, deal with this chronic disease. Yeah.
It does seem like technology is advancing to now you can just do it with like a little pinprick on your finger. But for those that struggle to have access to affordable insulin, that's got to be a big challenge. What is it like on your end of it to deal with people that come to you and be like, I can't afford this disease? I mean, that's got to put you in a tough situation.
No, it is. We see that almost every day, especially here. We do have some options. Like for example, we have cheaper insulin options. We have cheaper medication sometimes, and through Marshall Health, we have a Marshall Assistance Program as well. Through which some patients qualify, and they get a lot of expensive medications on insulin for some of them get it for free, some of them get it for a discounted price. and it did make a big difference in our everyday practice. But it is challenging, but it is definitely doable. In those situations, I would definitely recommend that they have endocrinology on board, just because the wide range of options they could have, especially when expense is an issue.
We talked a little bit about the challenges. What are some of the things that motivate you in your job? What are some of the things that you've been most proud of during your career?
Well, like I said, when it comes to chronic conditions, especially something like diabetes, the satisfaction you get from teaching patients on how to manage such a deadly but slow disease, how to take those small steps in getting there, and you see their blood sugars are doing better, they're losing weight. Overall, once you start losing weight and your diabetes is controlled, there are many other things in their everyday health which improves. And seeing that happen slowly over a few months in the follow-up, I think that is the most satisfying thing.
And you build those relationships with these people, right?
Absolutely.
They become lifelong friends almost.
Correct. Because unfortunately, there's no cure for diabetes. So
Right.
it's something you need to work on every day. But on the flip side, you get to build these long-term relationships with them, and it's fantastic.
So walk us through the process of when someone comes to you originally and they say, I think I'm just not feeling right. I'm a little bit off. What's the process from getting them in and talking to them and figuring out what might be going on through the diagnosis and then through the treatment? How does that work? Do you have a team? Is it something that you just are you doing one-on-one all with them?
We have a team. Most of the time, what happens is they go to their family doctor, they report their symptoms, and usually if there is a suspicion for an endocrinology disorder,
They'll refer them.
Correct. Then they're sent to us. And so many of the times they already come with a diagnosis, but sometimes they don't. So then, yes, so depending on the clinical history and what we find in physical exam, we work them up appropriately for that specific hormone or condition. And most of the times, almost always, the first few testing in endocrinology is always blood tests. Until we are very sure with blood tests, we don't even go to imaging. So most of the time it starts with blood tests. Sometimes we end up doing imaging, and then after all steps are completed, only then we start treatment.
Do you think there's ever a chance that we'll be able to find a cure for diabetes, or is this just one of those things that it's going to be tough?
I think it's going to be tough just because there has been so much research going on already. There are usually what happens is there is some exciting news, but then when they do it on many patients, it doesn't always work out. But even today, as we speak, there's so much research going on to find that cure. In fact, even in that front, we made some advancement. Now we have a infusion which act against the antibodies in type 1 diabetes, and they can delay the onset of type 1 diabetes, which is not bad, right? It's at least a step forward. So maybe few decades or years down the line, we will have something which can knock off those antibodies completely.
Of course, a lot of times the best treatment is prevention, not getting there in the first place. Some of these things are tough. I mean, if you have an autoimmune disease, you're probably going to get it no matter what. It's genetic or it's part of your DNA. But I'll give you a couple minutes to give our audience your best advice for a healthy lifestyle to try to stay away from endocrine problems if they can.
Well, when it comes to thyroid, like you said, it's hard. It's hard to there's not much through lifestyle you can do to prevent them, but at least it's important to be vigilant. So if somebody has, like I was telling earlier, family history of thyroid disease, you have other autoimmune conditions, or you have symptoms related to thyroid disease, it's a good idea to get them checked. But when it comes to conditions like diabetes, though, there are things which we can do to sometimes prevent, sometimes to delay the progression, and that mainly includes healthy eating, regular exercise as much as possible, and stress is related to many hormonal conditions. But I know sometimes it's easier said than done.
Sure.
Right? But whenever possible, working on that, and mainly being vigilant, and be it diabetes, be it any hormonal conditions, early screening and early detection always helps. Yeah. So that's something, just be cautious, just be aware of the symptoms you're going through and get them checked.
I think that's wonderful advice, and always good to err on the side of caution. If you're feeling down for a couple of years, you know your own body. So
exactly.
if you're feeling off in any way, that's something that's why it's so important to stay vigilant with your routine checkups and making sure that you're communicating with your primary care doctor so that they can get you to the place that you need to be. Well, that was a great conversation. I appreciate your time. Dr. Pruthvi Goparaju. Thanks.
Thank you. Thank you for having me.
Thanks for joining us. And thank you again. We can't do this without your support. Be sure to like and subscribe so that we can keep these coming. For the doctor, I'm Rick Lord. Until next time, take care.
That was the Health Source Podcast, presented by the Marshall Health Network.